Namaste. On behalf of Dr. Vittalrao Vikhe Patil Foundation's Medical College and Hospital, Ahmednagar, I, Dr. Mandar Chandrachud, welcome you all for today's webinar on World Cancer Day. The theme for this World Cancer Day is Close the Care Gap. It is a 3-year campaign for impact. The focus in year 2022 is on realizing the problem. In 23, uniting our voices and taking action. In 2024, together we challenge those in power. So I mentioned in this theme of the Close the Care Gap, the focus for year 2022 is access to life-saving cancer diagnosis and treatment should be equitable for all. In PSM, you know, one of the principles of primary healthcare is equitable distribution. So first we will know what is equality and what is equity. Equality means each individual or group of people is given the same resources or opportunities. And equity means recognizing that each person has different circumstances and therefore requires resources and opportunities specific to their situation so that everyone can enjoy an equal outcome. So in this first picture, left-hand side picture, you can find that the need-based resources are provided so that everyone can enjoy outcome. So in 2022, the first year of this Close the Care Gap campaign is all about understanding and recognizing the inequities in cancer care around the globe. This gap affects everyone, but these barriers are not set in stone. They can be changed, and we can expect a fairer vision of the future. A future where everyone can access cancer services without any matter of where they are born, grow, work, or live. So you all know what is cancer. So it is abnormal growth of cells characterized by clonality, autonomy, anaplasia, and metastasis. And different categories of cancer like carcinoma, sarcoma, lymphoma, etc. And types of cancer depending on the organ of origin, that is primary tumor or secondary tumor. Then what are the key cancer facts? So every year, 10 million people die from cancer, and at least 1/3 of these common cancers are preventable. Cancer is the second leading cause of death worldwide, and 70% of cancer deaths occur in low to middle income countries, and millions of lives could be saved. The current annual economic cost of cancer is $1.16 trillion US. So now we'll see about what is the most common cause of cancer, or in terms of incidence, that is occurrence of new cases. So considering the both sexes together, it is first cause or leading cause is breast cancer, followed by lung cancer, then colon and rectum, then prostate cancer, then skin cancer, then stomach cancer. So you all know initially lung was the leading cause of death, but currently it is the breast cancer. Now in terms of mortality, the common cause of cancer death is the lung cancer. So you have observed that the most common cause of cancer in terms of incidence is breast cancer. But breast cancer as a cause of mortality, it is the 5th one. So this incidence coupled with mortality, that gives idea about the prognosis. So breast cancer can be detected early, and with appropriate intervention, we can save lives. So we'll see this in the diagram of pie chart about the incidence and mortality of cancer. So this is combined for both sexes. So breast cancer is the leading cause considering the incidence, and for mortality, lung cancer is the leading cause. If we separately see for the males and the females, then for males, incidence as well as mortality is lung cancer is the most common cause. Then in females, for incidence and mortality, breast cancer is the leading cause. So if we see the geographic distribution of the cancer, this world map is showing, the upper part is showing the incidence in males. So you can see, if we see the India, then still the lip and oral cavity cancer is the leading cause of cancer because of the higher consumption of the chewable tobacco. And in females, now it is the breast cancer. Previously, it was the cervical cancer. Now this world map is showing the mortality. So in males, the mortality leading cause is lung cancer, but in India, it is the lip and oral cavity cancer, as the incidence is higher. And the breast cancer is the leading for mortality also. In this diagram, bar diagram, we can see as per the Human Development Index, the incidence and mortality of the cancers. The left-hand side shows the incidence and mortality in the higher Human Development Index, that is the developed world, and the right-hand side shows the in the underdeveloped countries and the developing countries like India. So what causes cancer? So you all know there is role of genetic factors coupled with the, exposure to different carcinogens like physical carcinogens, chemical carcinogens, and biological carcinogens. And you also know about the pathogenesis of cancer. There is damage to DNA and there is a sequence of events which leads to the malignant neoplasm. So if we have to enumerate the causes of cancer, then we can categorize into environmental factors and genetic factors. These all factors may act independently or there may be additive or synergistic effect causing the cancer of specific organ or various different organs. If we see the trend of the cancer, then at the beginning of the 21st century, cancer was the sixth leading cause of death, but now it is the second leading cause of death, not in the industrialized countries, but also all over the world. And reasons for this is, first is the longer life expectancy, then more accurate diagnosis of cancer, and the rise in smoking or tobacco consumption. Then cancer pattern, we have already seen in that world map of geographic distribution. So this cancer pattern varies from country to country. And this variation is because of environmental factors, food habits, lifestyles, and different genetic factors. So for example, stomach cancer is common in Japan, cervical cancer is common in Colombia, and oral and cervical cancer is common in Southeast Asian region. So the cancer pattern. So currently the highest burden is seen in the affluent countries because of the smoking and Western lifestyle and also the longer life expectancy. And common cancers, there are lung, colorectal, breast, and prostate cancers. In developing countries like India, still the 30% of the cancers are associated with chronic infections. Like HBV is the cause of liver cancer, HPV is the cause of cervical cancer, and Helicobacter pylori has role in causation of stomach cancer. And more than 2/3 of the cancer patients are already in advanced and incurable stage at the time of diagnosis. If we see the cancer prediction, so in this diagram, on the y-axis, it is showing the incidence of the cases, and the x-axis is showing the Human Development Index. So right from the underdeveloped countries to developing countries and the developed countries, in all countries, the cancer incidence is rising. And that's why we have to focus on this cancer. And for that purpose only, we are celebrating all these health days to make awareness. So like today's World Cancer Day, we also celebrate National Cancer Awareness Day on 7th of November. Okay, thank you. Now I will call upon our HOD, Dr. Shubhada Avsat Madam, for next presentation.
Thank you, Dr. Chandrachud, for highlighting us the cancer, global statistics of cancer. Once again, I welcome all the listeners for the event organized on World Cancer Day. I will be talking on Fight Against Cancer, a global initiative. Fight Against Cancer is the initiative which was started by World Health Organization, and the mission is world free from preventable cancer. The goal is all persons in the world will have access to the strategies which prevent, cure, and care. The theme for this year is Close the Care Gap, which is a step towards achieving the goal. So this is a global initiative, Fight Against Cancer, And what are the key strategies for this attending this initiative that we'll discuss? Before that, we'll discuss the course of cancer and various levels of prevention. So the first stage is the individual who is susceptible to the carcinogens, but cancer is not yet occurred. So it is a pre-pathogenic phase. So the level of prevention which is applicable in this stage is primary level of prevention, and possible preventive interventions in this stage are mainly the lifestyle, healthy lifestyle, in which we can avoid tobacco, we can avoid exposure to alcohol, we can consume the high fiber diet, which will be protective against colorectal cancer, then promoting physical activity and proper weight management. And the preventive goals in this stage are promote health, reduce impact of carcinogens, and reduce the risk factors. So next starts the pathogenic phase or early pathogenic phase. Here, the onset has occurred or there may be precancerous lesion. The level of prevention which is applicable in this stage is secondary level of prevention, where we can do the screening for colorectal cancer, breast cancer, or cervical cancer. And the preventive goal is to identify neoplastic disease at earlier stage so that we can give definitive treatment, or if we remove the precancerous lesion, we can prevent the further spread of cancer. The next stage of disease is the pathogenic phase or late pathogenic phase. Here, the consequences of the cancer has already occurred and the stage is irreversible. Here, the level of prevention which is applicable is tertiary level of prevention. Here, the interventions are, you can promote the healthy lifestyle, and mainly the goals are to maintain the quality of life by giving palliative care and prevent the complications. The key strategies to achieve the word free from cancer is, first strategy is prevent what is preventable. This you can get by means of primary prevention technologies. Second is cure what is curable, where secondary prevention strategy can be applied by early diagnosis and treatment. The third key strategy is relieve the pain and improve the quality of life of cancer victims. Here, the tertiary level of prevention is applicable. Now, what are the interventions? We can classify the interventions at national level, subnational level, and individual level. The national level interventions are core interventions, which we can implement with the help of existing resources. For example, enabling the health systems to provide the proper screening and treatment facility. That is a national level intervention. Subnational level interventions are with expandable resources. Here we require some additional resources. For example, additional resources required for health education program or additional resources required for screening program, etc. So these are expandable level of interventions. And the third level of intervention is a desirable intervention, which requires substantial resources. And here the target of intervention is individual. So towards high-risk individuals, you can implement these interventions. Now, what are the interventions at individual level? First is avoid exposure to environmental carcinogens, avoid exposure to ionizing or UV radiation, occupational exposure to carcinogen like asbestos should be avoided, alcohol and tobacco products should not be consumed, avoid air pollution, and promote health promotive measures like nutritious diet containing high fibers and promote the physical activity or exercises. Now, this slide shows the simple ways to reduce your own cancer risk. First, it shows do not smoke or stay away from the tobacco products. Make your home smoke-free by preventing indoor air pollution. Enjoy a healthy fiber diet. Breastfeeding is one of the important preventive measure in order to reduce the risk of breast cancer. Fortunately, some vaccines are available which can give protection against some cancers like hepatocarcinoma or cervical carcinoma. By giving hepatitis B vaccine or human papilloma virus vaccine, we can prevent these cancers. Avoid exposure to the sunlight and UV radiation. Reduce indoor and outdoor air pollution. Be physically active. Limit alcohol intake, or I will say avoid alcohol intake, and take active participation in cancer screening program. So if unfortunately we are having some precancerous lesion, it can be detected at earlier stage. Now, what is our role? As a medical fraternity, we have the role in all levels of prevention. So it is a comprehensive role. We have a role in primary prevention by giving health education to the community or by guiding health promotive measures to the community. We have definitive role in secondary prevention, especially my colleagues, Dr. Bhushan, Dr. Rohan, who are working as oncosurgeons. So they have a role in early diagnosis and treatment. Tertiary prevention, the many medical facilities are providing palliative care in order to improve the quality of life of cancer patients. Now, emphasizing primary prevention of cancer, again, I will give more focus on primary prevention by giving HPV vaccine, human papilloma virus vaccine. It should be provided to every girl child. If we give before puberty, 2 doses are there. And if we give it after the pubertal age, but it should be given before 25 years of age, three doses should be given. And hepatitis B vaccine, it also prevents the hepatocarcinoma, and it should be given to both male and females. Emphasizing primary prevention of cancer is by environmental approach. Here, we make healthy choices where we live, play, and work. Means we should live in healthy environment and it should be smoke free. Empowering and educating people to make healthy lifestyle choices by avoiding tobacco use, proper nutrition and physical activity, etc. Then promoting early detection and treatment of cancer, that is by secondary prevention. It has two distinct advantages. Firstly, by screening for cervical cancer or colorectal cancer, they have certain precancerous lesions. For example, cervical cancer precancerous lesion is carcinoma in situ. So if you diagnose these lesions at this precancerous level, and if you remove these lesions, then definitely the spread and further progress of cancer can be prevented. The second advantage of early detection is better treatment outcome. So if we detect the cervical cancer, carcinoma, or colorectal cancer or breast cancer at earlier stage, then there will be definitive treatment and the chances of survival will definitely increase. Then role of medical fraternity in secondary prevention. As I have previously told that our role is in all levels of prevention. In secondary prevention, we encourage community participation in cancer screening by providing health education and information related to cancer. We can support and train community health workers. Community health workers play a key role by giving the cancer information, by giving the services available for treatment of cancer, especially in rural area. So this is a very important factor that we should support and train the community health workers about the cancer. And by working within the health systems, we can definitely improve the quality of health services. The role in tertiary prevention by supporting cancer survivors and caregivers. Cancer survivors and their caregivers face physical, emotional, psychosocial, spiritual, and financial challenges because of the diagnosis as well as treatment of cancer. So surveillance should be there to assess the needs of cancer survivors, and accordingly we can implement educational programs for cancer survivors and caregivers so as to make the informed decisions. Now, what is the role of government or stakeholders? The cross-cutting priorities, that is the main role of government and stakeholders. And here PAC approach should be there, means policy, systems, and environmental approach. Policies to protect communities from harmful agents. For example, tobacco-related laws or legislations, they implement the smoke-free policy. So that is the one important example of policy. Systems. System approach means enabling health systems for conducting health education, for conducting screening programs, and for treatment. Environmental approach is by policies and laws, regulations to prevent the air pollution and ozone depletion. Then government role is by encouraging research or promoting research by giving grants for the research in the cancer. And definitely the important thing is allocation of resources. This is very important role of government, especially in underdeveloped and developing countries like India, where lots of resources are required and money, material, and manpower resources must be provided by government to fight against the cancers. So take home messages. Globally, cancer is a leading cause of morbidity and mortality. So first step is the identify the contributory factors responsible for cancer development, avoid exposure to environmental carcinogens, health promotion measures should be there like healthy lifestyle, specific protection by vaccination, early detection by actively participating in screening programs, and support cancer survivors and caregivers. So this is how we can achieve the goal of close the care gap. And the last slide, if we see the cancer, there is a word can in cancer because we can beat the cancer if we work together. Thank you very much. Now I will invite next speaker, Dr. Rohan Karde, to deliver his talk. Thank you.
Thank you, ma'am. So, we are celebrating World Cancer Day. So, we need to know more about cancer awareness. So, finding a cure is our goal, and spreading awareness plays a role. So, World Cancer Day was established in February 2000 at the World Cancer Against Cancer for New Millennium, which was held in Paris, organized every 4th of February and led by Union for International Cancer Control. World Cancer Day is a global initiative that aims to inspire greater awareness of cancer and action in better preventing, detecting, and treating the disease. So, for these 3 years, the theme was close the care gap. So, it has been already been highlighted by my colleague Dr. Mandas. So, what is cancer? So, cancer is a class of disease characterized by uncontrolled cell growth. There are over 100 different types of cancer, and each is classified by the type of cell that is initially affected. Cancer harms the body when altered cells divide uncontrollably to form lumps or masses of tissue called tumors. So, what are the warning signs for adult cancers? So, any change in wart or a mole, any continued fever, nagging cough, or continued hoarseness, chronic pain in bone or any other area of the body, enduring fatigue, nausea, or vomiting, repeated infections or inflammation, any change in bowel or bladder habit, a sore that does not heal, unusual discharge or abnormal bleeding, thickening or lump in breast, testicles, or elsewhere, indigestion or difficulty in swallowing, obvious change in size, color, shape, or thickness of a wart, mole, or mouth sores, noticeable weight loss, and loss of appetite. So, what causes cancer? Cancer arises from the mutation of normal cells. Mutated genes that cause cancers are called oncogenes. It is thought that several mutations need to occur to give rise to a cancer. Here, you need to notice that it's not the single mutation which causes cancer. It has to be multiple mutations. Cells that are old or not functioning properly normally self-destruct and are replaced by the new cells. However, cancerous cells do not self-destruct and continue to divide rapidly, producing millions of new cancerous cells. So there are multiple risk factors like smoking tobacco, radiation exposure, advanced age, general health conditions, obesity, diet, sun exposure, then some bacterial infections, viral infections, then hereditary causes and hormonal causes. So diagnosis and treatment. Diagnosis through physical examination, tissue biopsy samples, and imaging techniques like MRI, PET, CT. Treatment mainly consists of one or more of the following modalities like surgery, radiation therapy, chemotherapy, immunotherapy, or targeted therapy. So these are some statistics from India. Estimated number of people living with This dreaded disease is around 2.5 million. Every year, new cancer patients registered are over 7 lakh. Cancer-related deaths are around 5,56,000. Cancers of oral cavity and lungs in males and cervix and breast in females account for over 50% of all cancer deaths in India. So what are the top cancers in men? In men, it is mainly led by lip and oral cavity, while in women, it is the breast cancers. Previously, it was cervical cancer. So coming to lung cancer, so like around 1.59 million deaths from lung cancer occurs, and out of that, 87% lung cancers are due to smoking. So highest rate was found in Hungary. There are multiple reasons for lung cancers, like smoking. What is tobacco smoke? Any particulates, carbon monoxide, nicotine, benzene, nitrosamines, polycyclic hydrocarbons. This all comes under tobacco smoke. Men who smoke are 23 times more likely to develop lung cancer than those who don't smoke. And women smokers are 13 times more likely to develop the disease than their non-smoking counterparts. So these are the two images from smoker's lung and healthy lung. Prevention of lung cancers, like stop smoking, eat healthy diet, regular exercise. Oral cancers. Tobacco use accounts for 90% of the oral cancers. Alcohol around about 75 to 80%. So 57% of men and 11% of women between uh, between 15 to 49 years of age in India use some form of tobacco. More than 90% of oral cancers report using tobacco products. Women chewing tobacco are 10 or more times a day have a 9.2 times higher risk of developing oral cancers compared to non-tobacco chewers. So this is the image of advanced basal cell carcinoma of left face has rendered this patient incapable of eating and drinking anything. So prevention is like say no to any form of tobacco or gutka. Stomach cancers. Stomach cancer is difficult to detect and is typically diagnosed late. It is the fifth most common cancer in the world. 29% survive after 5 years. So factors increasing the risk for gastric cancers are like age, occurs mostly in people older than 55 years. It affects men twice as often as women. Mutations on BRCA1, BRCA2, CDH1 genes increases the risk. The family history increases the risk. And it is more common in Asian, Hispanic, Black people than the white people. Obesity, smoking, and H. pylori infections are the other risk factors. Symptoms of stomach cancer: indigestion or heartburn, discomfort in the abdomen, weight loss, nausea, bloating of stomach after meals. So, prevention of stomach cancer: avoid use of tobacco and alcohol, intake of diet rich in fruits and vegetables, indulge in physical activity, maintain a healthy weight, avoid salty smoked foods and processed meats. Now, coming to colorectal cancer. What is colorectal cancer? Cancer that develops from the cells of large intestine. Large intestine is made up of colon and rectum. Age of onset is around 45 years of age. Uh, Causes and risks are like a personal history of previous colorectal polyp or colorectal cancer, a personal history of inflammatory bowel diseases. Risk factors include low fiber diet, high fat, intake of alcohol, smoking, and obesity. Warning signs of colon cancer you shouldn't ignore are like constipation, diarrhea, blood in stools, narrow stools, unexplained anemia, tender abdomen or abdominal pain, unexplained weight loss, weakness, and fatigue. So, what you can do to reduce the risk factors for colorectal cancers, like uh, getting 150 minutes of exercise per week is an important part of maintaining a healthy lifestyle. Even exercising in 10 minutes burst is beneficial. Healthy eating habits like fruits, vegetables, whole grains, which contains high vitamins, minerals, and fibers and antioxidants, which may play a role in cancer prevention. One should quit smoking, then drinking in moderation, or don't drink at all. Then lose weight. If you're healthy, there are less chances of getting a colorectal cancer. Blood cancer. It is a hematological cancer, which is also known as blood cancer, which begins in the blood forming tissues such as bone marrow or in the cells of immune system. Hematological cancer, which is also known as blood, there are three different there are three main groups of blood cancer, like leukemia, which affects the white blood cells, then lymphoma, which affects the lymphatic system, an important part of the immune systems, which help to protect your body from infection and diseases. Myeloma, it is a cancer of plasma cells, which are found in the bone marrow and produce antibodies which help fight infection. In most blood cancers, the normal blood cells development process is interrupted by uncontrolled growth of abnormal type of blood cells. These abnormal blood cells or cancerous cells prevent the blood from performing many of its functions like fighting off infection or preventing serious bleeding. Symptoms of blood cancers are like anemia, easy bruising and bleeding, swollen glands or enlarged spleen, drenching sweats, especially during the night time, fatigue, fever, unexplained and unintended weight loss, compromised immune system, which can make patients more prone to infection. Treatment and prevention is chemotherapy and radiation. Although there is not much that can be done as preventive measure to avoid blood cancers. However, following things may help to reduce the risk. Avoid exposure to radiation, avoid exposure to chemicals, avoid smoking or tobacco in every form. So prostate cancer. Risk factors for prostate cancer: age more common in men age of 40 plus. Family history: if your father, brother, or son have had a prostate cancer. Race: African or American men are more than twice as likely to die from prostate cancer than the Caucasian men. Myth about prostate cancer is prostate cancer is only an old man's disease, which is not true. In fact, risk increases with age, but men of all ages should know their personal risk factors. So, what are the signs and symptoms for prostate cancer? Sexual dysfunction, changes in bladder habits, weakness or numbness in legs, frequent pain in the groin, blood in the urine. So, prostate cancer risk reduction. Eat plenty of fruits, vegetables, and whole grains. Limit your intake of red meat, especially high fat or processed meats like deli meat, hot dogs, and bacon. Get to and stay at a healthy weight. Be physically active. Get sufficient vitamin D. American Cancer Society states that recent studies found that men with high levels of vitamin D seem to have a lower risk of developing more lethal forms of prostate cancer. Avoid smoking and limit alcohol intake. Stay current on annual examination and talk to your doctor about your personal risk. So there has been vaccine Sipuleucel for prostate cancer, which is being nowadays used. Now coming to breast cancer. Breast cancer is the most common cancer in women in India and accounts for 27% of all cancers in women. Globecon 2012 data shows new cases registered are 1,44,000 and deaths are around 70,000. The incidence rate in India began to rise in the early 30s and peak at the age of 50 to 64 years. It is a decade earlier than the Western population. Overall, 1 in 28 women is likely to develop breast cancer during her lifetime. In urban areas, it is 1 in 22 women develops breast cancer during her lifetime as compared to rural areas. So this is just a staging of breast cancer where you can see early detection plays a role. Like if it is an in situ cancer, then we have survival rate around 100%. For stage 1, it is 98%. Stage 2, it is 88%. For stage 3, 52%. And for stage 4, it is 16%. So the survival rate drastically decreases as the stage advances. So early detection is very important. So coming to prevention, So for breast, it is breast self-examination, which is one of the most important thing. So what we need to look in breast self-examination, any lump, pulled in nipple, any dimpling, dripping from the nipple, redness or rash, skin changes like QD orange. We should be looking for these symptoms. So early warning signs of breast cancer: visible lump, any nipple change like inversion, dimpled or depressed skin, bloody discharge, color or texture. Prevention of breast cancer: avoid becoming overweight, eat healthy to avoid tipping the scale, keep physically active, drink little or no alcohol, don't smoke. If you bear children, breastfeed your babies for as long as possible. Avoid hormone replacement therapies. Cervical cancer. Cervical cancer is cancer of cervix, which is in the lower narrow opening of the uterus. Single biggest risk factor is having the high risk type HPV infection. Other risk factors include family history of cervical cancer, smoking, and infections like HIV, which reduces the immunity. So warning signs and symptoms like leg swelling, bloody stools, dizziness, fatigue, vaginal bleeding or any discharge, pain or bleeding after intercourse, menstrual irregularities, abdominal pain, and weight loss. So how to keep your cervix cancer free? Vaccination plays an important role. Like as ma'am has already explained, like two shots to be given, like two shots to be given before puberty, and after puberty, it has to be 3 shots of HPV vaccine. So and again, then there can be a PAP testing which can be done every 3 yearly, or get a PAP plus HPV test every 5 years. So some myths about cancer is a death sentence, which is not at all true. As we have seen in early stages, the cure rate is quite high. Cancer is always associated with pain. It is also not a true fact. Ignore the symptoms and it will go away. All the cancers are hereditary. Cancer is a communicable disease. These are all myths. Celebrities, now we'll see the celebrities who successfully fought cancers. So Yuvraj Singh, you all know, he has successfully recovered from mediastinal seminoma. And Manisha Koirala, who has successfully recovered from ovarian cancer. So Sonali Bendre was diagnosed with metastatic cancer in 2018. Then Hugh Jackman, he had 6 bouts with basal cell carcinoma, one of the most common forms of skin cancer. Now he has been recovered fully. And then Ben Stiller, the actor, was diagnosed with prostate cancer in 2016 when he was 48 years. So, in short, cancer is not a death sentence. With early diagnosis and intervention, the burden of cancer can be reduced. Avoiding tobacco products, eating healthy diet, regular exercise, regular health checkups are some of the strategies which can also help reduce cancer development. Thank you.
Thank you, sir. Now we have completed all the 3 presentations of today's webinar. I thank you, all the viewers or participants, for their patient listening. I also thank the college management authorities for their guidance and providing us constant comfort. I also thank the support staff for taking care of all the necessary arrangements. Thank you. Thank you very much.